Okay, so I was gonna try to post an update. I guess you can kind of tell, so probably why I've not posted. Um, I we think like the scratching of my throat, like when they put the tube down my throat, like into my lung, is like what's caused some of this. And then also I've had so much coughing and phlegm, just trying to keep my lungs clear, that I think also like it's just dried my throat out or scratched my throat. It's caused me to lose my voice. But I think also like I've pulled a muscle in the right hand side of my rib cage because like it's pretty painful. I'm still trying to take Percocets. I think that's probably the only reason I've had energy to like post, just because it kind of helps like numb. I mean, clearly that's what Percocet does, but like it's kind of taking the edge off. It doesn't actually get rid of all the pain, but it does take the edge off. But I just try to be really careful because my body just does not do well with anesthesia, narcotics. Not that I've ever really been a heavy drug taker. Thankfully, that's not something I've had to battle with. But my battle normally is if I'm not on top of trying to keep my body clear of specific toxins. I mean, I get overloaded and then my body isn't digesting food, and then like it's a whole slew of things. So anyway, yeah, like I don't know. So I'm sorry, you guys. I just haven't felt like posting, and I'm still in a lot of pain, and yeah. So, I mean, like, I'm trying to take walks. Like, I probably overdid it yesterday, but, I mean, I'm not like we're going really far, but like up and down the street and trying to get, like, keep things in my body moving and my lungs clear and all that. And, I have a post-op appointment next week. I finally have my thyroid appointment next week, too. Because if you guys have been following my videos, that's the next thing that I'm going to have to deal with is, they found some growths in my thyroid. I already had half my thyroid taken out in 2012. And so the likelihood that I would have more growth, I'm saying growth because they haven't specifically said tumor, mass. Although I've already been through this and I had a mass on the left side. It was stuck to everything. It was about the size of my fist and, or an apple or whatever. And so I've already been through this before. And so the likelihood of that coming back was high. Just really sucks because having half a thyroid is better than having none, and having no thyroid. Because if you know anything about thyroid, it regulates everything. The way your body digests food, cold and hot and cold temperatures in your body. Digestion, constipation, like motility in your bowels, hair growth, hair loss, like it's all a big mess. So anyway, yeah. So, yeah, this is why I've not responded or sent much of an update. So it's a little been harder than I thought. So anyway, yeah. So I'll try to respond to messages soon, you guys. Thanks for all the love.